Missing upper molars and premolars is common. The sinus expands, bone height vanishes. For many patients, implants need a sinus lift. If you want to move from single implants to predictable full arch work, first control the posterior maxilla. Master the sinus lift. It teaches precision, biology, and anatomy control, the same skills that make complex cases safe. The sinus lift isn't just a technique, it's a masterclass in surgical biology. You will learn how to elevate tissue without tearing it. You will learn how to manage bleeding, stabilize grafts, and maintain tension-free closure. Every one of these skills transfers to ridge augmentation and to full arch surgery. You also start to see bone biology in real time, osteogenesis, osteoconduction, and osteoinduction. You understand how bone actually forms and why biomaterial choice matters. That understanding is what separates a technician from a true implant surgeon. Here's a decision rule for sinus lifts. Measure residual bone height on CBCT scan. 8 mm or more, just place your implant directly. Anything more than 3 mm, you can use a crestal approach with osseodensification and some biomaterial. Less than 3 mm, go for a lateral window technique for visibility and control. Sometimes you have to stage it. At times, there's enough to place the implant at the same time, although 3 mm is not ideal to place an implant, especially if you have thin soft tissue. CBCT is mandatory. You have to identify the membrane thickness, you have to look at the sinus health, look for any septa or undercuts, check what's going on with the artery course and the osteomeatal complex. We need to make sure that it's potent. If the sinus shows disease or blockage, we have to refer our patients for ENT evaluation before our lift. Good planning removes most of the risk before you even pick up a handpiece. The lateral window is the foundation. Make a wide full thickness flap with tension-free closure. Outline the window 3 to 5 mm above the sinus floor. Thin the bone until you see bluish membrane. You can use either a rotating instrument like a diamond burr or your piezosurgery. Lift the membrane from the walls first. Make sure your instrument is always in contact with bone. Never push directly upwards, and then pack your graft slowly, gently, and make sure there are no gaps. Cover with a collagen membrane, or if you're using PRF, you can cover with PRF membranes and then close without tension. You just built vertical bone safely. The same logic applies to ridge and full arch grafts. Now, the crestal approach. Osseodensification uses densifying burrs, the Versah system, in reverse. We have two protocols that we can find online. Protocol 1, which is for small lifts up to 3 mm, and then protocol 2 for larger lifts where we can use some biomaterial to lift higher. My suggestion is always to attend the osseodensification course before you try and do it in a patient's mouth. This will allow you to do it safely by making sure that you will get the results you want without damaging the patient's anatomy. Think of grafts as scaffolds, not fillers. Vital bone grows inwards from the sinus walls and floor. Histology shows most new bone originates from the bony envelope. Your job is to protect that space and let biology work. Most complications are avoidable. The most common one, membrane tear. Use piezo tips or blunt rasps. Patch small tears with a collagen membrane or a PRF membrane. And if it's larger, you can definitely need to use either a big collagen membrane or use a technique that has been popularized by Dr. Picos, where he uses a rather large piece of collagen membrane. He creates a pouch which goes into the sinus, and the membrane edges are secured around the window edges. Some other complications are sinusitis, which is not common. You should avoid overpacking your graft because you don't want to injure the Schneiderian membrane and avoid graft migration. You also have to take care of the way you release your soft tissue and you achieve tension-free closure because we want to avoid soft tissue dehiscence. Now, all these lessons teach control, the skill every complex case depends on. You also have to tell your patients to avoid blowing their nose for at least 10 days. If they want to sneeze, to do it with the mouth open, to use warm saline rinses only, and review your patients at about 1 to 2 weeks after surgery. Wait for about 6 months before placing implants if it's a lateral window technique. Sometimes you can go back in and place implants in about 4 to 5 months if your biomaterials allow it and if you use PRF during the grafting process. Why is this the safest route to complex implants? Because the sinus lift teaches control of tissue, bone, and judgment. You learn to predict outcomes and know when to stop or stage. That experience protects you when you move into full arch and zygomatic cases. Master your sinuses first. Everything else becomes easier. If you want predictable, stress-free advanced implant surgery, start with your sinus lifts. It's the foundation for complex success. Thank you for watching. Please like and subscribe.